Step back. Let real doctors handle this. A resident snapped, blocking the brown-haired woman rushing forward. She paused briefly. Scrubbed hands in 3 seconds, eyes locked on the patient turning blue. You're just emergency nursing, don't interfere. 5 swift movements. Pulse returned. The chief surgeon froze, stared at those hands for a long moment, then whispered, "This isn't civilian training." The entire operating room fell completely silent, understanding something extraordinary had just occurred. Dr. Sophia Chun, 28 years old, moved through Chicago General Hospital with the quiet efficiency of someone who had learned that attention was rarely welcome. Her long black hair was always tied back in a simple ponytail, and her worn scrubs bore the permanent creases of countless 12-hour shifts. To everyone at the hospital, she was exactly what her badge claimed, an emergency department nurse who had transferred from another city after completing her nursing degree. But appearances can be deceiving. Every morning, Sophia arrived 30 minutes before her shift began. While other staff grabbed coffee and complained about their schedules, she methodically checked backup oxygen tanks, tested monitor batteries, and arranged startup kits in every procedure room. Her colleagues attributed this thoroughness to perfectionism, never suspecting it was muscle memory from a very different kind of medical training. When transferring patients, Sophia always crouched to eye level, whispering, "We'll go slow but steady." After shifts, she cleaned stretchers herself instead of leaving the task for housekeeping. These small acts of care seemed like the habits of a genuinely good person, which they were, but they also reflected training that had taught her every detail could mean the difference between life and death. Dr. Marcus Webb, the chief of surgery, had noticed Sophia during her 6 months at Chicago General. She was competent, he acknowledged, but she was still just emergency nursing, not qualified for advanced procedures. What he didn't notice was a faded paracord bracelet on her left wrist, tied with 3 precise knots, or the way her hands moved with surgical precision even during routine tasks. The strange marks everyone overlooked told a different story. When washing her hands, Sophia's left wrist showed a faded circular scar, suggesting prolonged tourniquet use during extended operations. Her personnel folder showed a pencil notation that knowledgeable personnel would recognize: FST Gray Zone, forward surgical team operations in unofficial areas where conventional rules didn't apply. The night that changed everything started with severe weather and multiple trauma cases. The emergency department declared code triage for mass casualty response, a situation that would test everyone's limits. At 22:14, a multi-vehicle collision brought chaos to the hospital. At 22:17, a male patient, approximately 30 years old with multiple trauma and severe blood loss, was rushed directly to OR3. Dr. Webb was composed but strict about protocols, while resident stressed voices overlapped in growing confusion. Sophia pushed forward to offer assistance but was brushed aside. "Don't touch anything. You're not authorized in the surgical area," a young doctor added dismissively. "This isn't ambulance work. Rules are rules." Chaos was developing rapidly. The monitor flashed warnings. The suction line was intermittent, and voices rose as the patient's lips grew pale and his pulse dropped with each labored breath. From the panicked room, Sophia entered what she privately called the zone, the mental state that had kept her alive and kept patients breathing in places where ambulances couldn't reach. She didn't argue, just positioned herself in the clean pathway she'd mentally mapped during her shift preparation. For tiny movements within 3 seconds, angled the equipment kit toward the surgeon's dominant hand to reduce reach distance, switched backup suction into the auxiliary port to prevent blockage, folded gauze into triangles for one-handed opening, and gave a gentle shoulder touch to the resident, signaling for quiet. 10 beats of silence. The noise level dropped. The monitor showed the pulse steadying slightly. Dr. Webb looked up, and his eyes stopped at Sophia's hands. The deep callous lines between her thumb and index finger, the thick palm muscles. These were signs only seen in personnel with extensive field surgical experience. When the anesthesia resident struggled with instruments, Sophia whispered very quietly, "Blue airway, green warm field." Color code she'd use in operational medicine for airway management and temperature maintenance. The resident didn't understand, but complied because Dr. Webb nodded approval. The transformation was remarkable. In 90 seconds, What had been chaotic became controlled. The airway was clear, pulse returning, and the surgeon entered optimal operative flow. Dr. Webb glanced over and whispered a phrase only Sophia heard. "This isn't civilian training." Sophia didn't respond. She touched a silver pen in her chest pocket. Engrave would breathe, then decide. A gift from her commanding officer during border service. She counted the 3 knots on her paracord bracelet and stepped back to the clean pathway. Her systematic approach had transformed a chaotic situation into a controlled surgical procedure, demonstrating capabilities that exceeded standard emergency nursing training by significant margins. The entire surgical team's performance had improved, not just because of her technical skills, but because her presence had created calm focus that enabled optimal performance under pressure. Dr. Webb recognized professional competence when he witnessed it. He understood that Sophia's capabilities represented years of intensive training and practical experience under extreme conditions. But security protocols prevented detailed questioning about military service records that might explain her advanced capabilities. After the surgery concluded successfully, Dr. Webb found Sophia at the scrub station. "Where were you trained to keep a steady heartbeat when the entire room loses rhythm?" he asked quietly. Sophia looked in the mirror, somewhere without hospital signs. Dr. Webb understood. He asked a single-coded question. "Gray zone?" Sophia nodded. "FST Gray Zone, 2018 to 2020. Gray Zone had been exactly what it sounded like. Unofficial forward surgical stations in hotspots where power failed regularly, equipment was scarce, and screaming was more lethal than bullets. There, Sophia had learned the science of silence. The first 10 beats of any crisis determined 50% of survival probability. She'd maintained patient pulse for 47 minutes during a sandstorm, changed an entire surgical tent's rhythm using 3 keywords and hand signals. Her training had included combat surgery, vascular repair, field anesthesia, and emergency amputation procedures typically restricted to specialized military medical programs. When operations concluded, Sophia's records remained classified. She'd requested reassignment to Chicago General, starting over as a quiet rhythm keeper. She sought no glory, just wanted everyone returning home safely. Dr. Webb assembled the night shift team. "Tonight, a patient survived thanks to someone we pushed out of the surgical area. Her name is Dr. Sophia Chun. From now on, the Quiet 10 Clean Pathway protocol becomes standard in our OR." The anesthesia resident who had dismissed her flushed red and bowed his head. "I apologize, Dr. Chun." "No problem," Sophia replied quietly. "We're all afraid of losing people." Dr. Webb looked serious. "But some people learn to transform fear into rhythm. Learn from her." Sophia's background extended far beyond a single deployment. The Forward Surgical Team Gray Zone had been an elite military medical unit, combining advanced trauma surgery with battlefield medicine, creating specialists capable of performing complex procedures under impossible conditions. Field medicine isn't about perfect conditions. Her instructors had taught. It's about saving lives when everything fails, using whatever resources exist. Sophia had absorbed these lessons completely, developing capabilities that exceeded civilian medical training and mastering techniques that saved lives when conventional approaches failed. Gray Zone operations had been her final assignment, missions combining medical support with tactical operations requiring dual expertise in surgery and operational security. During one engagement, multiple personnel had been trapped with conventional evacuation impossible and medical support unavailable through normal channels. Sophia had performed 12 emergency surgeries using improvised equipment, working without electrical power while maintaining sterile conditions under operational stress. She had saved lives that conventional medicine couldn't preserve, using techniques that were later documented, studied, and incorporated into military medical training throughout Special Forces medical communities. But operational security had prevented official recognition or public acknowledgement. Her transition to civilian medicine had been carefully managed with sanitized records and assignments that wouldn't trigger security reviews, allowing quiet service without compromising ongoing operations. Within weeks, Sophia's protocols were implemented throughout the hospital system. Surgical efficiency improved, patient outcomes enhanced, and personnel who had initially dismissed her sought training and mentorship. The 10-beat protocol became standard, The first 10 beats of every emergency case required silence, clean pathways, and systematic preparation. Setup time was reduced by 18%, pathway confusion eliminated, and airway establishment became 20 to 30 seconds faster. Dr. Webb offered Sophia opportunities for surgical residency advancement. Your skills exceed most qualified physicians, he said privately. But Sophia declined. I'm here to help, not advance my career. Service means contributing wherever needed. Her decision impressed medical leadership more than her surgical demonstration. Choosing mission over recognition, patient care over professional advancement. It was dedication that inspired rather than demanded acknowledgement. 22 to 2300 hours, the legacy. 2 years later, Sophia received an invitation to direct an emergency medical training program, developing protocols for high-stress medical situations and teaching systematic crisis management. She accepted conditionally. Maintained clinical duties while providing specialized instruction, served dual roles without abandoning direct patient care. Her training programs revolutionized emergency medical education, emphasizing systematic preparation over reactive response, environmental optimization over equipment dependence, and psychological discipline over technical perfection. 5 years later, the 10-beat protocol was standard throughout the regional healthcare system. A memorial was established for military medical personnel, recognizing contributions to civilian healthcare and acknowledging service that often remained classified. Sophia attended the ceremony quietly, standing among the crowd rather than accepting featured acknowledgement, honoring colleagues' memory through continued service rather than public recognition. In her chest pocket, Sophia still carried a piece of sand-colored canvas fabric cut from a field surgical tent during a snowy border night where her teammate had fallen. On the fabric's edge, she'd hand-sewn 3 small letters, "Back Alive." This story isn't about superheroes. It's about calm discipline. Job titles don't save people. Proper rhythm does. The first 10 beats in any situation are golden moments determining the entire outcome. Looking back at quiet people around us, some hands once held lives in canvas tents beyond borders and now arrange supplies in city hospitals. They don't tell stories about snow, sandstorms, or scars. They just want everyone going home safely. When you want to shout to win an argument, remember someone kept quiet to win a life. Breathe, then decide. Sometimes that's enough to change everything. Dr. Sophia Chen's experience illustrates a fundamental truth. Exceptional capability often exists in unexpected places, works quietly, and serves without demanding recognition. The emergency nurse might have combat medical training. The support staff might possess specialized knowledge. The quiet colleague might have saved lives under impossible conditions. Excellence doesn't require recognition. It requires consistency, dedication to mission, and focus on results rather than acknowledgement. Sometimes the most important contributions come from people institutions underestimate, and life-saving expertise might be found in the most unassuming colleagues. The next person who saves your life might be someone you barely notice, someone whose hands once worked miracles in places where miracles were the only option for survival.